Nearly 48,000 Americans die from suicide each year, and for every death, there are 25 attempts. That's according to the CDC. September is Suicide Prevention and Awareness Month, and giving us some time now to talk about something that is usually off limits is Dr. Anat Geva from the HealthONE Behavioral Health and Wellness Center. Thanks so much for talking with us today. First, we just want to know, how do you know someone is struggling with suicidal thoughts?
Thank you for having me. Suicide and suicide awareness is very important because so much of it is happening around us. And if we don't ask, we don't know. So the best way to know is really to ask people. And you don't need to jump in with, are you suicidal? Although if you have concerns, then you should. You can ask someone, how are you doing? How have you been doing? Usually we don't ask, and when we don't ask, we don't know. So the direct method is one way, and an indirect method is just to look at the people around you and to spend a moment considering if there is a marked shift from how they usually are to how they are today.
And if you get that answer that's concerning, then how do you step in to help someone who is struggling?
Well, I think a lot of us are not prepared for that answer. So first of all, being prepared that that may be an answer, providing that empathy, understanding that it is hard. It's been very hard for many of us. And then also providing that connection. So 988 is a great resource. And then also our walk-in centers are a great next step if you have imminent concerns for someone you care about. And also reassuring them that you're with them and you're at their side throughout this.
And you mentioned this, the new National Suicide Prevention Hotline. It went live in July. Mental health help is now 3 digits away. You mentioned 988. How have things changed since then?
Oh, it's been amazing. The uptick in the number of people seeking help shows that we really benefit from having that access, that directness, and knowing if we can do that for someone else, we might be saving a life.
The National Alliance on Mental Illness says 90% of teens who die by suicide have a mental health condition. So how can we treat a young person before those thoughts of suicide occur?
Really what we're looking at is depression, anxiety, trauma, and these are things that are usually easy to spot on the outside. So seeing a kid who is either overacting or underacting, so someone who's very apathetic, not engaging, not really participating in their life, be it their academics, their friendships, their home life, their activities, or seeing someone who is very agitated and restless and realizing that there's something happening behind it. And those really usually are depression, anxiety, or trauma. The beauty is that you don't need to be a clinician to diagnose these conditions. You just need to see something that is either different than the normal or just something that raises some kind of red flag in your head or triggers something in your belly. And if you have those, really go seek professional help because they will help you tease out what is going on.
Very good information. Dr. Anat Geva, thank you so much for talking with us today.
Thank you very much for having me.